I've been a mental health nurse for about 35 years, I guess now, up 20 years in practice and 15 years at university. Although I am still in practice as a psychotherapist, I've always maintained currency over clinical work. I like to turn people out fit for purpose. I like to think that our mental health nurses are also out there changing and transforming practice, that they're engaged with research and they're working hard at work, and I bump into them every now and then or they contact me, and it's really rewarding to know that we're supporting the National Health and Social Care Service as well as supporting people in their lives. The way we organise the students' learning is to work with other professions. We work multidisciplinary in practice. I've spent years working multidisciplinary in practice, and we want our students to have that experience here. So here they'll be working with in a multidisciplinary team, so to speak, and in practice they'll be mirroring that, because they'll be going into MDT meetings and pulling in conversations with social workers and nurses and other professions and medics, to make sure that we manage our the structure of care properly for people. You leave this programme with not just a good education, but also the ability to register as a professional and to work for a living and make a difference in mental health. We prepare people to work in many areas in practice. So we prepare them to work in hospital because they have placements in hospital, and we prepare them to work in a community because they have placements in a community. And we prepare them to work in the third sector and the wider areas because their core transferable skills of being a mental health nurse can be located in all those different areas. Because you've got a range of experience on placement and a range of people that you work with here, you can apply for a range of posts within the NHS and social care. I think it's worth you trying to understand what a mental health nurse does. I think, if you know a mental health nurse, then you could ask them, what's your typical day like? I would recommend coming to an open day, because you can speak to us there, and we can advise you about mental health nursing and nursing in general and the like. So I think that they're organised so that you can get a real flavour of the university and a real flavour of the programme. And we do a presentation there as well, and we're available for you to have conversation with us afterwards. And I think people tend to go away with a good sense of what Hallam's about and what we as a mental health nursing team are about here as well.